And I believe we are live. I'm going to.
And let me go to your page.
Yeah.
We are live. Didn't see it pop up on my page. Oh, it's on my page now.
Got it?
I got it.
All right. All right. Good evening, good afternoon, everyone, and thank you for tuning in with me on Mondays with Mel, which happens each Monday at 2 p.m. Central. We are live, and first of all, happy Mother's Day to all the moms out there.
Yes, happy Mother's Day. Belated Mother's Day.
Yeah, belated, right. And I am so excited to have this special guest on today. Her name is Dr. Nicole Plenty, and she is phenomenal. Guys, when we spoke last week, it felt as if we were kindred spirits and definitely had a lot more in common than we even knew, right? I would think. So she is a wife, she is a mom, she is also a maternal fetal medicine specialist who is currently practicing in Houston, Texas. So I want you to welcome her to Mondays with Mel. So Dr. Nicole, thank you so much for joining in with me on today. And we're gonna go ahead and get started, okay?
Absolutely. Thank you so much for having me. I appreciate it.
So first of all, for those who do not know, tell everyone exactly what is a maternal fetal medicine specialist.
Well, it's funny because even some doctors don't even know what that is. And so I have to break it down to a lot of people. Maternal fetal medicine basically is a high risk pregnancy expert. So I am an OBGYN by trade. And so I did residency in OBGYN, and then I did 3 more years to specialize in just high risk pregnancies. So meaning I diagnose fetal anomalies. I treat moms that may have a history of a heart attack or stroke or hypertension, diabetes. They may be morbidly obese, advanced maternal age, and people that may have in vitro fertilization for pregnancies. Okay. So anything that deals with a high risk pregnancy is what I do.
Okay, so that being said, as we were just stating, yesterday, of course, was Mother's Day. Mm-hmm. Last week was I believe it was May 6th, was what I think the name of it is maternal, maternal mental health awareness day. So that with all of those things, and ironically, this past weekend is always very hectic for our family because 2 of our 3 children were born this past weekend.
So you have birthday parties and
right
virtual birthday parties right now.
Right. So what are the odds that we would be covering the topic of managing pregnancy and new mommy anxiety in the midst of COVID-19? Because the reality is, I could not imagine, I think as we were talking last week, I really can't imagine what it would feel like at this point to, in 2020, have been giving birth to either of them this month of this year.
Yeah.
Right. So one of the first things I really want to just kind of pick your brain about is, what are some of the stressors? What is some of the anxiety that you are currently seeing with the regular routine type pregnancy?
Sure. So if you have a routine pregnancy, for the most part, I'm seeing those women for just their anatomy scans or a consult just to make sure they're not high risk. And so most people have anxiety around the fact that they can't bring their spouse to the appointments, right? So
Mm,
the men are like, well, this is my baby too.
wow.
And we're like, well, the mom's, the vessel that's
Right.
carrying the baby. So the biggest stressor is just not having that support person with you. So you
Mhm,
go to your anatomy scan, and what happens if we actually find something?
mhm,
A lot of people are nervous and they want to make sure that everything's okay, especially if they've had, a miscarriage in the past, and
right.
so they're extremely nervous. People are stressed out about not having their spouses there. A
Mhm,
lot of practices now, I'm in Texas, so a lot of practices now are allowing at least one person to come during the visits, as of literally recently, as of last week, when
mhm,
some of the cities in Texas opened back up. But some states haven't opened up anything yet. And
mhm,
so people, have to talk to their spouse over the phone if we find something. And then the other stressor is, some people have lost their jobs. So if
right.
you lost your job during this pandemic, and now you have to figure out, okay, how am I going to afford these medical bills? And how am I going to afford to feed and clothe my family? So those
Mhm,
are the two biggest things, people not being able to fill their prescriptions because they just don't have the money. And then people stressed out because their partner isn't able to be with them. Now,
wow.
for the most part, some hospital systems have limited the people that can come to delivery. So, in addition to the outpatient, you
Mhm,
may not be able to have your husband and your mom there.
right.
Some hospital systems are stricter than others. Most hospital systems aren't making women deliver alone. There are a few that I know of, but most of them aren't. But you
Yeah.
are having to limit who you can bring with you. And if you have other children, they can't be there.
Wow. So what is some advice you can give for those dads maybe? Are you seeing any anxiety or stress that those moms are coming in and or those mommies to be are coming in and speaking about in reference to, a dad that wants to be involved, right? That within itself is huge, that you have a significant other that wants to be involved, and we're in this current situation in which they can't come to those appointments.
So if it's a prenatal appointment and they're there with their OB, I always tell patients, don't be afraid to ask, like, can I call my partner? Can I FaceTime my partner during this visit? Because we do want our dads to feel included. Um,
Right.
we want them to be included the whole time. So when the baby gets there, they can't be like, well, it's on, it's on you now. Um, no, we want them to be included. We want them to feel included. So even during a lot of ultrasound appointments, dads are not allowed. You can't videotape or FaceTime, but they may be able to make an adjustment for that.
Mhm,
For my patients, I have allowed them when I come into the room. I've allowed them to, FaceTime their partner. If
mhm.
they've already had their scan, I usually go back over just so the dad can see. Medical legally, there's a lot involved with ultrasound and being able to videotape and record.
Right.
It can create some artifact in the room when we're saving images. But you can always ask after it's complete, hey, can you show my husband the face, or do you mind FaceTiming? And for the most part, most providers will ask, is there somebody you want to get on the phone now, or is there somebody I need to call afterwards so they can understand everything going on? And
Mm,
don't be afraid to ask those things. In terms of your appointments, not your appointment, your delivery, I always encourage people to plan for that, right? So
right.
if your spouse can't be there, or your mom can't be there, you can only have one person, have a little delivery party, have a little virtual party, get your kids
Right.
involved so that they can see mommy in the hospital before you deliver. Now,
Mhm.
you may not want them there when you're pushing, but have a little, virtual Zoom party for your family to see you go in the hospital, or you can make a video and send it out to them, you know, when the baby's born, so that they can be involved. So there's different ways to get people involved if they can't be there.
Okay. So I know, I think Amanda was just saying, I'm trying to read comments and listen at the same time. And so Amanda was just saying that that's been one of her biggest issues, is that the doctor's office was saying that she couldn't bring her husband to that first visit, you know, and that first visit is, you know, that's huge. That's when you hear the heartbeat and it's a real thing.
Well, if she can't bring the dad to her husband to the first visit, she can always ask when the dad can come for them to let him hear the heartbeat then. So you should hear the heartbeat at every single visit. And I know that it's exciting to have the, you know, the first visit,
Right.
spouse be there, but realistically, there's a lot of just paperwork that happens in the first visit. You know, and sometimes you don't even hear the heartbeat. Sometimes you're too early to even get an ultrasound in the first visit. So I would say make every single visit like the first visit. Make every single visit count. And if you can't FaceTime him, if you can't do a video for him, when they do open up appointments, you know, ask your OB, hey, can you, you know, do a quick scan on me, or can you let my husband hear the heartbeat because he's never heard it? Most doctors will be accommodating and very understanding, especially during the pandemic.
I think that is an absolutely wonderful idea. I know a lot of people may or may not know, but my son, who his birthday was on this past Friday, and he's now 10, but when he was born weighing in at 2 pounds.
Oh, wow.
And yeah, 2 pounds, 3 ounces. So I'm very familiar with the high risk road.
Yeah.
You know, the high risk road is honestly the one my husband and I know the most about. And so, you know, I want to kind of segue into really the nuts and bolts of your specialty, which is the high risk pregnancy. Because I also was reading not too long ago an article that mentioned a mom, a mom to be, who went in and she was going to deliver, and there were some complications. And so, what are some ways that the high risk mom, right, the one that you really are more involved with, can really look for? Because you know, that's a very special place in my heart, you know. So what do you have to say?
I don't know too much about low risk. I mean, I have, just for background, I have a Tim. No, he's actually 11 months. 11 months, and I had an extremely high risk pregnancy and had, you know, a blood clot in my leg that was huge, and 3 blood clots in my lung, and
even more in common.
I know, hyperemesis, admitted. I had a C-section. I lost consciousness. I had to get a massive blood transfusion. So I had a lot going on throughout my entire pregnancy. So all I know is high risk, pretty much.
Right.
And so if you are a high risk pregnancy, one, you have to recognize first that you are high risk. So if you are over age 35, so I'm 37, if you're over age 35, believe it or not, even if you are a sprinter, you are high risk pregnancy. If you are obese, I'm obese, I can admit that. Hey, because some people think, you know, I'm thick, so that doesn't mean I'm obese. And some people think, oh, if I'm obese, then, you know, that must mean that I'm fat, or this is this unattractive word, and it's really not.
Right.
But we have to face the fact that, hey, if you are overweight, I mean, your BMI is over 27, or obese when your BMI is over 30, then we have to face the fact that we are a little bit more high risk than somebody that has a normal pregnancy. So first is recognizing that you're high risk, and then two, if you have some symptom, and not even of COVID, but you just don't feel right, you need to talk to your OB and let your OB know that. So I think I know the article you're talking about, which is a 26-year-old. She was African American and Puerto Rican, and she ended up finding her own platelet trends decreasing, and asked her OB, and her OB said everything was fine. Saw her virtually, and then didn't get any follow-up in person. And she ended up having an extremely complicated pregnancy and ended up passing away a couple of days after delivery. Mm-hmm. And I always tell my high-risk patients, advocate for yourself.
Right.
I tell patients all the time, I trust you more than I trust myself. So if it doesn't feel right to them, then it's not right. And I need to make sure that I'm checking all of the boxes to make sure that they're careful. Now, in this COVID crisis, that's become more difficult because you do have people that are seeing you virtually, like over a Zoom video.
Right.
And so if you say, oh, I have contractions, they're asking how far apart are they? Trying to figure out if you're somebody that needs to go to the hospital or not. But if you're not feeling right, you're having symptoms, somebody needs to see you. And Absolutely. It doesn't matter if you're trying to not go to the hospital, because that's why I have a lot of patients. I send them in, I say, oh, you might have preeclampsia, which is high blood pressure and vascular damage. We look for that damage as protein in your urine. Mm-hmm. African-American women are way at risk to have preeclampsia, and that is hypertensive disorders of pregnancy, one of the number one causes of maternal death. So we really can't play with this thing.
Right.
We'll try to make excuses for their blood pressures being high. You can't make a blood pressure high. People are like, oh, I was running to the visit, so my blood pressure high, but your pulse is 70. Mm-hmm. So it's not you running to the visit. You really need to get checked out. And so I find myself, because of this COVID crisis, in addition to the struggle that some people have just realizing that they're high risk, realizing they may need a preterm delivery, realizing that they need a hospitalization. Now I'm having to convince them just to come in. Wow. Or convince them just go to the hospital because they don't want to be exposed. And so for those patients, I caution you, if your OB says you need to be seen in person, if you need to be admitted to the hospital, if you check your blood pressure at home and you know it's high, please don't ignore that. Go to the hospital, but take precautions. And so precautions you can take, obviously, make sure you wear a mask, right?
Right.
And so if everybody wore a mask, even like the little surgical mask, doesn't have to be an N95, then that could decrease the rate of transmission down to only 5%, especially if you can't keep your distance from people, which in the hospital, you really can't. Nowadays, the issue is everybody doesn't want to wear a mask, right? Everybody doesn't want to wear a mask.
Right.
People get mad when you ask them to put on a mask, and then people don't want to go to the hospital. So that is the biggest struggle I've had with my patients during this pandemic. Mm-hmm. They don't want to wear a mask. They don't want to go to the hospital. And I'm begging them to go to the hospital. Not every OB is going to beg their patients to go to the hospital. Right. Now, I'll beg you because I care. And I've had a cousin that passed away from complications, specifically a preeclampsia, and she had an eclamptic seizure and ended up having aspiration pneumonia, and she died. And this is before I was a doctor. So I'm very sensitive to the fact that we think we can take care of everything ourselves.
Absolutely.
And we don't want to get help. And psychologically, we're stressed out. And that could be leading to more complications in pregnancy, which means that you really do need to be seen.
Right.
So I'm not too proud to beg. I beg my patients, please get checked out, because we'd rather be safe than sorry.
Right. I know. I always think about even, our younger population, right? I was speaking with someone, and we were talking about, younger ladies who are pregnant. So these would be your 15-year-olds, your 17, your 18, 19-year-olds who are pregnant and having a baby, and their baby may also end up being high risk or different things such as that, and because they're younger, of course they're more prone to not be privy to maybe the wisdom of an older mom, or big mama, or just someone that's saying, hey, you have to go to the doctor, you have to check these things out. Are you seeing a lot of difference with maybe the younger population?
Not really.
Women? Okay.
No, in terms of not in terms of the pandemic and younger patients. Younger patients have always been. What I found with them is they don't really believe it's real. So for them coming into the clinic or going to hospital isn't really that big of a deal, right? And
Okay.
so we still have that population that's going to the ER because they have a positive pregnancy test,
Mm-hmm. Mm.
or not getting any prenatal visits until the very end because they're in denial because they're pregnant. But I haven't seen a difference in terms of compliance, non-compliance, because of the COVID pandemic. Most of those patients come in and ask me if it's real. That is what they ask me, if I think it's real. If I'm talking about my 15 or 16-year-old
Mhm.
patients, do you think it's real, Dr. Plenty? Yeah, I think
Mm.
it's real. Just because you don't have it doesn't mean it's not real. You don't want to get it. We don't want to find out how real it is. We want to not get it.
Absolutely right. Right.
But no, I haven't seen a difference. That population, to me, has acted the same exact way, and it's a matter of making sure they understand the importance of uh, getting care and being consistent with care,
Mhm.
and also making sure they have a support system. It hurts my heart when I see a 15-year-old or a 16-year-old that's coming to clinic with their mom who's still mad at them because they're pregnant. And so, they
Right.
already have the stress of, oh my God, I'm pregnant. And
Right.
then they have the stress of, this guy over there may not want to even claim this baby.
Right.
And then it's the mom that is mad at them in the clinic.
Right.
So we're still seeing the same thing, except for the mom can't be with them in the clinic. So now it is a lot of, trying to figure out what's going on at home.
Mhm.
Some of the hearsay things that go on because, the mom's not there that patient's mom is
Right.
not there to speak up for themselves.
Right.
It's just what the patient says. So that's pretty much been the only difference there.
Okay. So, last thing I want to really segue into is the mom who comes in to deliver who has been exposed possibly,
Sure.
because I know one article I was reading talked about a mom who was getting ready to deliver, and she had been exposed to COVID-19 and had been in self-quarantine, and her results were not back yet prior to her going into labor.
Sure.
And so there was a different process that came about because her results weren't back. And so of course, the hospital team treated it as if she
She's
really did right. So how would we deal with that?
So most hospital systems are screening everybody that delivers 4 days before they come in for their scheduled delivery, or if they haven't gone into labor by the 39th week, they're getting screened at that point. Most hospitals they have resources. There's one hospital system here that I have privileges at that's not doing that universally. They're only
Mhm.
screening people that have symptoms or that's been exposed, like the situation you're talking about.
Okay.
And so if you test positive, or you have symptoms, or you've been around somebody who's tested positive, or who has symptoms that haven't been screened, you are treated as if you're positive. And so what that means is when you arrive, you will get screened. So let's say you didn't call your OB and tell your OB that you had symptoms or you had an exposure. They're going to screen you anyway. And so as soon as you say you've had an exposure, you will have to have an N95 mask on, and they
Mhm.
will basically make sure nobody else is in the room initially. Okay.
Mhm.
So that's the only difference. You can either bring somebody back with you initially and have them there during the whole time, or you can't bring anybody back initially. So initially, you're going to be one-on-one with your nurse and your provider. That nurse usually doesn't have anybody else unless there's other people that have concerns of being positive. Okay, so most people are divided into a positive side and a non-positive side. So a high-risk side and a non-high-risk side, whether that be on different floors or whether that be, on different sides of the unit. And so that patient and the nurse and anybody that enters that room will have to have on an N95 mask. Also, will have to have a head covering on, and then the nurse will also be gowned with the shield on. Okay, and so anybody that's positive or thought to be positive will have that. Okay, and so it will feel a little bit uncomfortable. It'll
Right.
feel as if something is wrong with you, but there's nothing wrong with you. People
Right.
are just taking precautions. Okay.
Right.
And they expect that anybody that enters your room will also have those same precautions, and they will be provided with those protective equipment devices. You will be allowed to have somebody in the room with you delivering. Okay. Unless you are in an ICU setting, if you are able to breathe on your own, for the most part, if you're stable enough to be in a labor and delivery room, you can have somebody in the room with you if you're delivering vaginally. If you're delivering via C-section, you will not be able to have anybody in the room with you. And that's because if you need to be intubated emergently, it can really increase the amount of respiratory droplets in the room, and it could put anybody that's in the room with you at extremely high risk of exposure. And so they won't allow anybody in the C-section with you, but you will be awake, you can see the baby, and your partner can be in there immediately afterwards in most systems. Now that could change in the matter of a couple of weeks, because everything is forever changing.
Right.
But for the most part, if you're delivering vaginally, it would feel the same, except for you would have on a mask and everybody else would have on a mask and a head shield.
Right. So moving on to.
Oh, wait, Melanie. The other piece is that's a big deal is that if you are positive or known to be positive, the baby will likely be separated from the mom. That has been a psychological driver, and people that I've dealt with, even the thought of that, they have, separation anxiety.
Right.
People don't, they feel guilty about not being around their baby. They feel guilty that their family can't be around them. But rest assured that 1, you will be allowed to breastfeed. 2, the baby will be allowed to go home with you once you have the baby will go home with you regardless. But once you have a negative test, then you won't have to take all the precautions. But once the baby goes home with you, if you're positive, then yes, they are asking the baby to be basically separated from the mom, and you will be basically looking at your baby through a video. And it's a big deal. At least until you are 48 hours without any symptoms. And the reason that is, there's no vertical transmission that we know of from the studies in New York and the ones in China, meaning the baby's not getting coronavirus through the vaginal canal, okay? They've done amnios, which is like when you take a needle and insert it to the uterus and withdraw fluid. And those amnios have been negative in those positive women. So we don't think that babies are getting exposed to coronavirus, okay? But we do know that there have been babies that have been positive a couple days later. Right. And so with babies that don't have an immune system, although psychologically it is overwhelming for a mom not to be able to hold her baby initially or be with the baby for prolonged periods of time, you will feel even more guilty if something happened to your child. And so I just always encourage my patients to say, this is very temporary. And you are doing the best you can by allowing yourself to distance for a short period of time and continuing to breastfeed and pump for that short period of time. That's the best you can do. Because most of my positive patients, they haven't been anywhere. They've gone to the grocery store. They've been exposed to their husband that's been working, but it's not like they're out on the Capitol protesting and they happen to get COVID. I mean, most of them are pretty asymptomatic carriers, or they have, very mild symptoms and they happen to be exposed. They haven't done anything wrong. So I always just tell people, 1, it's not your fault. You can't help where this virus goes. All you can do is do the best you can, try to stay home. And if you happen to be positive, know that it's not your fault, and know that you're doing the best you can to make sure your baby does not get sick and you don't have any long-term complications.
Right. So that being said, I know after giving birth to my son, even I think as a mom, when you've done all you can do and all to be right, there is still that sense of guilt. What could I have done differently? Should I have taken that last trip to the grocery store, or just whatever? Is there any way I could have prevented this? And so I know you and I were having the conversation of of patients utilizing mental health resources. And I know as far as perinatal mood disorders go, how definitely something such as those type situations could lead into those mood disorders. So are you seeing more hospitals move towards having maybe even social workers, or just some sense of therapy immediately available?
Absolutely. So for the most part, people that have tested positive, all of them are recommended. Now you don't have to take it, but counseling services are recommended for everyone. Okay, and whether that's the behavioral health department or the psychology and psychiatric departments of the hospitals, patients are offered counseling, and they are assigned a social worker if they test positive. And that's really for any infectious disease. If you have any infectious disease, that's pretty much protocol. Some people don't want to take those services.
Right. I know we had that conversation.
And so I, like I said before, I'm not too proud to beg. And so I'll beg you, because I don't think that people understand how much of a toll just having a baby mentally takes on you. Like, let's not talk about the pandemic. I want all my patients that are having babies to talk to a social worker or a psychologist. All of them, okay? Because the changes with your body, the hormones, hormonal changes, the changes in your sleep pattern, that by itself is a lot.
Yes.
And me being a one-time mom, I didn't realize that as a provider until you get home and you realize this person is dependent on me forever.
Yes.
And
what am I supposed to do?
What am I going to do? Right? And then your husband's looking at you like, you're supposed to know what to do.
Right. You're the mom.
That itself is a lot. And so then you have to deal with, if you test positive, the guilt of potentially giving it to somebody else in your family or your child.
Absolutely.
Plus taking care of yourself, because moms do not prioritize themselves. And so I always tell patients, pay attention to your symptoms, seek help if you need help, and please get the counseling and then follow up with the counselor. If you have an underlying issue with anxiety or depression, then you need counseling regardless if you test positive or not. And I recommend that for anybody that I've seen that has a history of anxiety, depression, to get some form of counseling, whether that's group counseling or whether it's individual counseling, immediately afterwards, and then the next 2 weeks after pregnancy, after delivery, because postpartum depression, postpartum blues, postpartum psychosis, they're real things.
Absolutely.
And people think, there must be something wrong with me if I find myself crying at night, or there must be something wrong with me if I feel like I'm overwhelmed. There's nothing wrong with you. Anxiety and depression are just like any other diagnosis, right? So if you have diabetes or you have hypertension, you go get checked out for that stuff. You take insulin for diabetes, and you take, Procardia or lisinopril or labetalol for your high blood pressure. So why are you not getting counseling for depression, right? And so people let it go, a really long time until they, end up having a break, and then you end up having to be hospitalized or on medicines. You don't have to be on medicines if you have anxiety and depression, just like you don't have to be on medicines if you have high blood pressure or diabetes. If you do the work first, and you seek help early. And I think that the pandemic, we're seeing more and more people that aren't diagnosed with anxiety and depression that come in extremely anxious or in a depressed mood because they're overwhelmed just by the thought of potentially getting infected. And they're overwhelmed by what they're seeing on the news and all the changes that's going on at their job. So people have had more anxiety and depression because of COVID. And so I definitely think that even if you don't have a diagnosis, if you're feeling funny, if you're feeling some kind of way, if you're not getting sleep, if you find yourself overeating or undereating, tell somebody so that you can get some help.
Right. Or even those that, go ahead.
sorry, the other piece, Mel, there's a lot of women that have added stressors from their spouses. Okay.
Mm,
And so I always tell people, you never know how a relationship changes until money is involved.
right.
Okay. And so with
Absolutely.
people losing their jobs, I've seen an increased amount of people in domestic violence situations, and they have to, they're dealing with those things on top of everything else they're dealing with, on top of the pregnancy. Please tell somebody if you're being verbally abused, physically abused by your spouse or anybody else, because people that get stressed out may tend to be in a violent situation. And you know what they say, hurt people hurt people.
Hurt people hurt people. Absolutely.
So definitely seek help. Nobody's going to think anything bad of you. We want to help you. We want to give you resources to get out of that situation. But we don't know about the situation unless you tell us.
Absolutely. Absolutely. I think it is very important because, like you said, a lot of times there are those additional stressors. Even the new mom who doesn't feel the attachment, that they should or think they should with their new baby.
Yeah.
And all of those are warning signs. And I think a lot of times the biggest reason individuals don't seek help is often family members.
Mm-hmm. Yeah.
Because the family members are often saying, "Oh, it's okay. Oh, you'll come. She'll come around. Things are okay." And trying to fight through that. So you're on your end, not too proud to beg,
Right.
and I'm on my end saying, please come see me. Please.
Yeah.
I am here.
And
Like, let this be your safe space. But there are so many voices. There are so many people that are saying, "Oh, you don't need a therapist. You don't need that. That's
no, and
that's
I know
that's for crazy people." No, it's not. This is not.
absolutely.
This is not a. You have to be diagnosed, and I use the air quotes with that. This is not a. You have to be diagnosed with something. This is simply a. I don't feel quite like myself.
Right.
And because I don't feel quite like myself, let me seek some help for this. Let me not continue to burden my husband or my sister or my mom or whomever. Let me get an outside professional to help me cope better. Because for
And
some
that's
for a lot of
with
you know
anything.
yeah, because for a lot of people, therapy is simply that. It is simply learning to cope and having a place to just go, just to breathe and let it all hang out without fear of bias, without fear of judgment. And so I'm right there with you when it comes to, like, hey, not too proud to beg, please.
Right.
Listen,
Yeah.
come. Let's talk
Come
about
in.
these.
Let's
Yeah,
figure out what's
right.
going on.
Let's do it. So I want to get to the new mommy. Right? We've had the baby. We're home, or we're going home. What are some ways to prepare for going home as a new mom?
So, especially during this pandemic,
Right.
where you're not supposed to have a whole bunch of people in your house, right? I always tell people now, prepare the people that need to help you. So if you know you want your mom there with you, helping you for, I don't know, a couple weeks afterwards, you're going to have to tell your mom she needs to self-quarantine for a couple weeks. Just not be exposed to anything. Go to the grocery store, get her 2 weeks worth of whatever, quarantine for 2 weeks, and then she's not exposed because she's been in our house for 2 weeks. Then she can come to your house. So I would definitely prepare people so that they're not bringing anything to you or your newborn. but you do need help. Okay. Don't believe the hype that you don't need help. You need help.
Absolutely.
So, and the pandemic is not going to change the fact that you need help. It changes the fact that people can't just come over on a whim, but you can get people that are your family members prepared. So if they can not be around people for a couple of weeks, make sure they wear a mask out. Then they can come over. But you do need to make sure you have a schedule, and please get help. Second piece, make sure you go ahead and go to the store and get everything you need. Send your husband out or your boyfriend out to get the things you need so that you won't have to run back and forth to the store, to the grocery store. So make sure you have plenty of food there. Make sure you have your pump supplies. Make sure you pick up your prescriptions before you get home from the hospital, so that you will have all those things and you won't feel like you necessarily need to go out. The other piece is, know that you will have to go out with this baby in the first week. Okay. The baby has to have a 1 week appointment. Okay. So make sure that you have a cover for your car seat, your baby seat. Babies can't wear masks. So babies under the age of 2 should not have a mask on because they can't control their carbon dioxide level. But you should cover the infant, and you should have a mask on when you go to the doctor's office, and make sure that you know what time that is. Make sure you know if they have people in the waiting room. So ask your OB, how has this changed since the pandemic? How is my newborn appointment going to happen, so that you are prepared? So during this post-pandemic era, it's all about being prepared. Okay. Right. And then sleep when you can. When the baby sleep, you sleep. Yes. Okay. Get plenty of sleep, and do take some time for yourself mentally.
Self-care. Yes.
Women are always on. And so you need that help so that you can take a half a day or a day just to do nothing except for catch up on sleep, do your own hair, do your nails. When the pandemic is over, go out and get a mani-pedi. You need self-time before you have a break. Because I'm telling you, a little person that needs to be breastfed or bottle fed every 3 hours around the clock can be a lot. Yes. So make sure you take care of yourself and prepare. Absolutely.
That is a job. Self-care it's really funny because sometimes even during sessions, if it's just with a female, I'll sneak in self-care. We may meet at the gym and walk the track, or we'll walk outside, and I'll say, hey, I'm trying to sneak it in, so to let you know you can do this, this whole self-care bit. There was a question. The question is, what are your thoughts on working during the pandemic while pregnant? And that was from Amanda.
So it just depends. So some patients that are high risk, so if you have hypertension or heart disease and you're like one of my high risk patients, I'm telling you not to work. And that's because pregnant women we're not seeing that they're getting terribly sicker than the average population. So like pregnant women that get the flu, they get sick, okay? Mm-hmm. Pregnant women with COVID, there's a lot of people walking around asymptomatic with this thing, unless you have risk factors. So hypertension, diabetes, heart disease, those patients, I'm telling, I don't think I want you working. And unless a couple things. One, you're working with a mask on. Two, you are able to distance yourself. So you are in a space where you're 6 feet away from somebody, so you're not really exposed to anybody else's personal space. Then yeah, those are people that can probably, continue to work. But if you have a high risk condition and you're in an office in a cubicle with somebody, 2 feet away, those people, I'm being very cautious and saying that I don't recommend that they still work. Obviously, everybody's situation is different. Right. If you haven't been at that job for a year, or you don't have FMLA, you may have to work.
You have to.
Yeah, you have to. I mean, I can't tell you not to support your family or support yourself. And so I would just tell people, make sure you have on a mask, and then you can't get coronavirus if you have on a mask and eye protection unless that person is like literally coughing or unless you are touching something with it on and then touching something on your face, like your membranes, your mucous membranes. So if you have to work, make sure you're not touching your face, okay? Make sure if you have somebody that has flu-like symptoms, make sure that you're reporting that so those people can go home and you're not exposed. And then wash your hands as much as possible. Hand sanitizer is reserved for when you can't wash your hands. Mm-hmm. So if you can't wash your hands as much as possible. Make sure you're wiping down your workstation a couple of times a day. So I usually wipe, I obviously I'm in the clinic, I go to work. So I wipe my station down as soon as I get there. I use either Lysol or Clorox wipes or alcohol, and I spray my keyboard down, I spray my desk down, and then I do the same thing at lunch, and I do the same thing at the end of the day. That way, if you happen to have viral particles that's in your area, you're at least getting rid of those things. For low risk patients, they can work, they're usually not getting extremely sick. The biggest thing with patients that are pregnant with coronavirus, their biggest risk is postpartum, not during the pregnancy. Mm-hmm. So postpartum, because of things that can happen with fluid shifting, the first 24 to 48 hours after pregnancy, as most people know, your blood volume doubles in pregnancy. After you deliver, it has to go somewhere, right? And so that's why you have a lot of swelling after you deliver those first couple weeks. You'll be at more risk for having that fluid that accumulates in your lungs if you have an underlying lung infection. So that's the biggest deal. But again, people that are low risk are not extremely at high risk for those things unless they're symptomatic. But people that are high risk are at risk for those things. And so I would tell them, you would need to distance yourself, and you likely not work.
Okay. All right. So I think we are about to wrap up for today. So I want to thank you so much for joining me today. You also have a website called Pregnancy Pearls, right?
Yes, it's www.pregnancypearls.com. I started that site because there was just a lot of people asking questions, and they were either not comfortable asking their OB, or they forget to ask their OB, or they just want a second opinion. And so because of the maternal mortality rate in the US, I started that as to be a resource for people so they can ask questions and have access to a high-risk specialist. So Great. Yes, and I'm also on Facebook and Instagram under the same name. Instagram is pregnancy_pearls. But my Facebook page is just Pregnancy Pearls with Dr. Plenty.
All right. So ladies and gents, if you're out there and you know someone who is pregnant or a new mom to be, and they have questions regarding pregnancy, regarding being a new mom, please have them reach out to Dr. Plenty. She is full of information. She ain't too proud to beg for you, and she is very passionate. Also, if you are out there and, as we've talked about, you are dealing with those thoughts of depression, those thoughts of feeling overwhelmed, or just not feeling quite yourself. Hey, reach out to me. Feel free to inbox me, even if you're not in this area, and maybe we can find someone in your local area to get you set up with for therapy. But please reach out, and don't forget every Mondays with Mel, 2 p.m. And so thank you guys for joining us today, and have a great rest of the week.
Awesome. Bye. Thanks for having me.
Bye. Thank you.